Let's study about prolactinoma and hyperprolactinemia. What is prolactinoma? Prolactinoma is a pituitary tumors that produce prolactin. So, in this term, it is itself written that prolactinoma. So, this tumor will secrete prolactin, and most of these tumors are microadenomas. That means they will be less than 10 mm in diameter. Next is, what is hyperprolactinemia? Hyperprolactinemia is elevated levels of plasma prolactin. As it is written in the term that there will be hyper means increase, prolactin means increase prolactin, and mia means in blood or plasma, or we can say serum. So hyperprolactinemia is elevated levels of plasma prolactin. What are the causes? Causes are, it can be physiological, that is in pregnancy, lactation, and during sleep. They can be pituitary tumors, example prolactinomas, hypothalamic and pituitary stalk disease. Due to this, as we know that hypothalamus have inhibitory effect on pituitary gland for prolactin secretion. It means that prolactin is in continuous hypothalamic inhibition. So in routine, there is no secretion of prolactin, only it is secreted in pregnancy, lactation, and during sleep. And due to hypothalamic and pituitary stalk disease, there will be removal of the inhibitory factor or inhibitory action on prolactin. So there will be hypersecretion of prolactin. Next is primary hypothyroidism. Other causes can be chronic renal failure, cirrhosis of the liver, and some drugs also causes prolactin hypersecretion, that are dopamine receptor blockers, as dopamine inhibits prolactin secretion. If we inhibit dopamine, so there will be hypersecretion of prolactin, and these drugs are phenothiazines and metoclopramide. Next is dopamine synthesis inhibitors like alpha methyl dopa, rizopine, opiates, cimetidine, and estrogens. So, cimetidine is also causing pituitary hyperprolactin secretion. What are the clinical features that are seen due to hyperprolactinemia or due to prolactinoma? Are there will be galactoria in both sexes, both in male and in female. We can see galactoria. Galactoria is milk ejection in absence of pregnancy or lactation. There will be milk ejection, that is galactoria, and in that secretion fat cells are present, that will confirm that this is milky secretion. Next, the symptoms can be amenorrhea, oligomenorrhea, menorrhagia, and infertility in females. So in females, we can see amenorrhea. Amenorrhea means there will be absence of periods. Oligomenorrhea means there will be decreased periods, and menorrhagia there will be heavy periods. And infertility. In males, we can see loss of libido, impotence, infertility, and gynecomastia. So it causes infertility in both sexes, both male and in female. Next is, a sufficiently large macroadenoma is usually associated if the prolactinomas are macroadenoma. Usually it is microadenoma, but if macroadenoma of prolactin is present, then it will cause the pressure effects due to which there will be visual field defects, and if it is compressing the other parts of pituitary, so there will be hyposecretion of that parts. Investigations, there will be raised plasma prolactin levels. They will or we can study the pituitary anatomy and assessment of other pituitary functions. We can do MRI, CT scan. Okay, so what is the treatment? We can give bromocriptine 2.5 mg thrice daily, or we can give cabergoline, that is 1 in weekly. Next is these both are dopamine agonist. These agents reduce the secretion of prolactin as well as the size of the tumor. Cabergoline is preferred, then bromocriptine. Next is transsphenoidal removal of prolactinoma if dopamine agonists do not help or there is a large invasive tumor. So when the medical treatment is not having results, then we can do transsphenoidal removal of the prolactinoma. Next we can do is external radiotherapy, which is rarely required. It may be considered in cases that are resistant to medical treatment and have poor response to surgery. Asymptomatic patients who do not require restoration of pregnancy should be monitored regularly and given estrogens to prevent bone loss. Thank you for watching. Like and subscribe.